War Talk Radio. This is Dr. Tong Li, your host here with my co-host,
Kurt Wilhelm, and we're excited to be talking to you about making a New Year's resolution to have your face be very, very smooth and perfect for your social media in the following year.
There you go. And we're going to go from home remedies, the things you can do in the kitchen, to the high-tech. All of them. You can pick and choose. The first thing to do, obviously, is trying something at home. And if you need to go for the high-tech, the technology is out there.
Yeah, and I believe in it, by the way. I talk about holistic things and, eating wonderfully, and that all can really help get your body balanced right. But at some point, there's some DNA that you may be fighting, and it's nice to get some high-tech help.
So just now we were talking about the conventional things that, that's being done, including antibiotics, and those are good for severe episodes, you want to break the cycle. But it's really not something that you could take forever because there are downside of it.
Mm-hmm.
And there are also oral contraceptives for females. You can take that, I guess.
Yes. Now that's something I wanted to talk about as well, similar to the antibiotics, that it's a little bit nerve-wracking. Nobody's really talking about that if a woman is on contraception for multiple number of years, there are side effects to having contraception.
Absolutely. Yeah. This is we usually do our disclaimer, basically.
Let's do the disclaimer.
Yeah, go ahead.
Okay, so here's the disclaimer, is that we want you to listen to us, of course, and everything that we share on our shows are educational in nature. However, we are not your doctor. So even though Dr. Li is a doctor, and even though I'm not even a doctor at all, you need to be under the care of your physician. And if you don't, if you like what Dr. Li has to say, you might want to come under the care of Dr. Li and Dr. Robledo.
Absolutely, but a lot of advice are just for your information.
Yeah, it's
and you got to take it
informational
with a
only.
grain of salt.
Absolutely,
Yes.
grain of salt, and your personal physician. Always, feel free to you should always talk to your primary care physician and compare some notes.
Right, oral contraceptives, because acne is related to androgen, which is a male hormone. The contraceptive is usually female hormone. So, in a way, it can help with acne. So the next thing is spironolactone, which is a hormone. It has a hormone-like property. It is a diuretic, which helps you to get rid of water buildup in the body. So a lot of this drug is getting a little popular. A lot of people are on that for acne, and same thing. It is something you can use, but it's not something treats acne from the root. And there's some also antibiotics. Other type of antibiotics can be used too. Creams and lotions, and benzoyl peroxide, retinol products, those things are used too for acne. Those help your skin to shed, to exfoliate, so hopefully the blockage goes away faster. So these are the things many people have tried with or without results. So the next big thing that I'm excited about, we have also had a lot of experience doing, is something called Levilon photodynamic therapy. If everything else we've talked about, or even the home remedy, which we haven't talked about yet, everything else failed. Levilon is a great choice for acne. Here we have our expert, Dr. Robledo, here to share with us some of those wisdom and information.
Sure. Levilon is one of the primary treatments that we use in our clinic for treatment of acne and acne-type conditions, such as rosacea. The reason that we like to use Levilon and or otherwise photodynamic therapy is because it treats 100% of the surface that we apply it to. And it treats to a level that we cannot visibly see, but it has a beneficial effect on the patient. Levolon is aminolevulonic acid. It's a normal substance within the cells. And for some reason, the cells that are inflamed or damaged have like a thirst for this substance. So when you apply it on the skin, it's applied like an oil. It's primarily absorbed by the damaged cells and the cells that are inflamed, which is nice. So we bypass a lot of the normal cells. Now, we let it absorb for several hours, and then after that, we activate it with a special blue light. All the cells that absorb this substance, once the acid is activated, will die. And then the body gradually absorbs these dead cells. So it's a nice treatment, and it's directed especially toward the damaged cells and inflamed cells. And that's what's nice about it. The normal skin is, most of it is preserved, it's untouched. You do see a general redness of the area when you apply the treatment, but that subsides after a few days, and it's a very good treatment.
Absolutely. So, in a nutshell, it's a medical treatment that actually uses a photosensitizing drug, and then you apply, after incubation time, you apply a light source, which activates the applied drug, which is Levolon.
But the drug is found naturally in the body, is that correct?
Yes.
Okay.
Actually, that substance is naturally found in the body. The result is the activated oxygen molecule, which can destroy the disease, selectively destroy the nearby cells. This was actually approved by FDA for a skin condition that's precancerous or superficial early stage of cancer, something called actinic keratosis. So it is also used, though, for acne, for rosacea, skin cancer of some other kinds, sun damage, cosmetic skin improvement, also for oily skin.
Very good. So if I didn't want to cut in as soon as you're done with that segment, is it okay that I talk about my experience?
Oh yeah, it also, I just want to add,
Sure.
it also treats wrinkles. It gives skin rejuvenation, and is also used for warts, for psoriasis too, and many other skin conditions. Just to mention that it's not for moles and birthmarks. Those are too deep usually.
Okay.
So I know you've had some experience with it.
Yes, I actually got this treatment about a year ago.
Want to share?
Absolutely, I'd love to share a good experience. And so last Christmas time, I actually went through this with Arizona Laser and Skin, and Dr. Li and Dr. Wilhelm put me through this treatment. So from a recipient standpoint, would you call me a patient? Patient.
Whatever.
Okay. So I wanted to do it for three purposes. I didn't have a lot of acne. However, I did have sun damage, sunspots, that came throughout. How much time do we have left in the segment? So I
think we're still good.
Okay. And so I wanted to get rid of some of the sunspots, sun damage, freckles, whatever you want to call it. I also tend to turn red very easily, so I don't know if you call that rosacea, but
it's a mild.
It's a very mild version of it, and so my face is easy to turn red. I also wanted to be able to get rid of as many wrinkles as I could, and since then, part of the rejuvenation is the collagen, natural collagen growth that comes
whenever you
when
have
heal.
a skin peeling. You grow new skin. You got that.
Yeah,
You
so
got
you get a little
collagen.
bit of extra collagen, and I did not expect as dramatic a results as I got. And I actually didn't look at myself in the mirror and say, wow, what handsome skin. It was just that people reacted really well out there in the public. They were surprised that I looked so good, and they wondered, you know, are you using lotion lately? What is it that you're doing differently? But they noticed that I looked very good. The part that I did notice and was very pleasantly surprised with was the removal of all the spots. Now, I'm not saying they removed 100% every single spot that I had. And you're right, the ones that were dark spots.
Deep.
Yeah,
Mostly.
deep.
Yes.
I have one deep spot, and it's right here on my forehead. But that's it. So the rest of them went away, and I was quite impressed with how well it worked. Now, the experience was exactly what Dr. Li and Dr. Robledo say, is that, you know, I came in the far toward the end of the day before my treatment, and then that way overnight they had the chance to absorb into the damaged cells that are damaged over the years from being a cowboy and having, you know, the cowboy going in and do this. See, look, if the cowboy can do this, any man or woman can go in there and do it, and I'm also admitting it publicly. So look at this; it's actually becoming more in vogue and in trend. But the experience was great, and also it was surprisingly painless. I'm not saying there isn't some discomfort, but it was surprising. There's a little sting.
Well, everybody perceives it differently. Some people say, well, this is nothing. Some people say, wow.
It's pretty tough.
So you're
It's
more
like
in the middle.
plucking. I would compare it to plucking your eyebrows. If you've ever plucked your eyebrows, and it's not that I pluck my eyebrows, but you know, every once in a while you have to pluck some, you know, say your eyebrows or, you know, somewhere, and it's that little teeny sting. It's not bad. It's really not bad. And then it is enough that people might, when they see you, they will definitely question what's going on with your face. You know, so you want to
For a few days, yes.
For a few days, you want to kind of, you know, do it during a holiday, during a time where those who know and love you will see you, and those that don't know you.
Some people call it social downtime.
Yeah, social downtime, absolutely. So I was, and then at the end of it, yeah, my face peeled, and then it was amazing that all of those spots went away. It was a great experience.
Skin like baby butt.
Yeah, it was essentially, more like a baby's butt. So I definitely can testimonialize the experience, and that's not the only type of treatment there, but it's what applies to today's conversation, and I had a great experience.
Well, that's good.
Mm-hmm.
Thank you for sharing.
You bet.
So, acne.
Oh, also call to action if you would like to go to azmdlaser.com, learn more about it. I'm not sure if there's before and after pictures up there, but eventually they may get up there, and you can actually see what I used to look like and what I look like now.
Yeah, absolutely. You definitely can do that when you come to our office consultation, because
There we
we
go.
don't always put all the pictures up.
Yeah, and I'm not lobbying for that. It's just if I'm up there, they can see me. If not, come in and make an appointment, and they'll show you.
So our actually our website is azmdlaser.com, and our phone number is 480-598-9733. And you know, if you have any questions, my email is tongli.md@gmail.com. That's tongli.md@gmail.com.
And also, if I want to emphasize what Dr. Li said, I found out, I haven't told you this, that a person very near and dear to me, I just found out had cancer in his jaw. I'm not saying these two are related, but if you feel like you might have some sun damage that could turn into cancer, this might be one of the preventive measures that you take.
Absolutely. So, so Levilon, being a very good treatment for acne, is also used for rosacea.
And when we come back from break, we're going to talk more about rosacea and how that can benefit you as well if you're like me when your face turns a little bit red. So thank you for tuning in. We'll be right back after the break. This is Kurt Wilhelm, the co-host of Ageless Living here on World Talk Radio and Voice America.
This is Dr. Tong Li. Don't go far away. We'll be back.